Today, I'm diving into a critical global health issue that's been making headlines: the delayed arrival of mpox vaccines in Africa. It's been 2 years since the outbreak began, and the vaccines are just now reaching the continent. Let's break down why this has happened and what it means for the future of global health. First off, the World Health Organization declared mpox a global health emergency in August 2022. But despite this, Africa, where a new strain of the virus was spreading rapidly, didn't see vaccines until recently. This exposes a glaring disparity in global healthcare. Wealthier nations secured vaccines within weeks, while African countries were left waiting for donations. One major hurdle has been the WHO's slow process in granting emergency licenses for vaccines. Without these licenses, international agencies like UNICEF and Gavi can't distribute vaccines to low-income countries. This bureaucratic delay forced African nations to rely on donations, which are often unreliable and insufficient. The first batch of 10,000 vaccines, donated by the United States, only arrived in Africa recently. But experts estimate that 10 million doses are needed to combat the outbreak effectively on the continent. The reliance on donations not only creates uncertainty, but also risks delaying critical interventions. The situation is particularly dire in the Democratic Republic of Congo, the epicenter of the outbreak. Thousands of suspected cases and hundreds of deaths, primarily among children, have been reported. The new mpox strain, clade IB, is more transmissible and affects children significantly. The delayed access to vaccines has exacerbated the impact on these vulnerable populations. This delay is a stark reminder of the persistent inequalities in global health. Despite the lessons from the COVID-19 pandemic, the international community has failed to prioritize equitable access to vaccines and healthcare resources. Experts argue that the WHO and other global health organizations should have acted much sooner to improve access to mpox vaccines, diagnostics, and treatments. What's needed now is a paradigm shift in global health governance. A more equitable system would ensure that all countries have timely and affordable access to essential healthcare resources, regardless of their economic status. Strengthening health systems in low-income countries and investing in research and development for diseases that disproportionately affect these populations are crucial steps. The world must prioritize a more just and equitable global health system. Only then can we hope to prevent future pandemics and ensure everyone has an equal chance at a healthy life. Thanks for tuning in. If you found this video informative, make sure to like, share, and subscribe for more content like this. Stay healthy and stay informed.